Do you guys remember the famous quote from Mean Girls where the health teacher says, "Don't have sex because you'll get pregnant and die"? Well, I'm here to tell you, you won't get pregnant and you won't die. There's a safer way to form sexual intercourse, and that is by a male getting a vasectomy. Men should get a vasectomy because vasectomies are reversible rather than tubal ligation. Female sterilization is more expensive than vasectomies, and vasectomies are way safer than women's sterilization. Now you're probably wondering, what is a vasectomy? A vasectomy is male sterilization where he cannot get a woman pregnant. A tubal ligation is where a woman cannot get pregnant. It's a procedure where she can't get pregnant. Now, I've had an interest for a couple years as to why it seems that women are always the ones to be sterilized, such as birth control, but it's never talked about that men can also be sterilized too. Men should get a vasectomy because vasectomies are reversible rather than tubal ligation. In Mayo Clinic's 2020 article, they described the procedure process of a reversible vasectomy, the percentage of pregnancy rates after a reversible vasectomy, and the risk factors. A reversible vasectomy procedure is very quick. It's when the doctor goes back in and reconnects the vas deferens back together, which is where the sperm travels back down. Now, the sperm does take a couple weeks to go back to normal. With that being said, it's about a 30% to 90% pregnancy rate. Now, the low risk factors include small pain, bleeding, and infection in the scrotum. Here's a picture of what a vasectomy looks like. This is not a reversible vasectomy procedure, but it's what a vasectomy looks like. In Sarah Schaffner's 2018 article, she discusses how tubal ligation is a permanent form of birth control. However, it can be reversed, but it is highly not recommended. Now, female sterilization is very hard to reverse. The high risk factors include unable to get pregnant, infection, bleeding, scarring of the fallopian tubes, injury to nearby organs, tubal cysts, and the worst one yet, an ectopic pregnancy. Now, an ectopic pregnancy is when the egg is being developed in the fallopian tubes, which is not normal. The egg is supposed to develop in the uterus. This is what a tubal ligation procedure looks like. You can tell because they take scissors and they cut the fallopian tubes and then they tie them together, making sure the woman does not get pregnant. Now, this is what a normal pregnancy looks like. You can tell because the egg is being developed in the uterus, while an ectopic pregnancy is when the egg is being developed in the fallopian tubes, which is very dangerous. Not only are vasectomies reversible, but also female sterilization is way more expensive than vasectomies. In HFR's 2021 article, they discuss how much more costly tubal ligation surgery is compared to a vasectomy. Now, a vasectomy costs $500, and it's also free in Canada, while a tubal ligation costs $6,000. That is a big difference in money. In PMC's 2011 article, they discuss how much happier couples were with their decision of getting a vasectomy, while women who regretted getting a tubal ligation. PMC conducted a group of people who had gotten a vasectomy and a group of women who had got a tubal ligation. So the 63% of couples who decided to get a vasectomy were very happy with their decision, while the women who got a tubal ligation regretted their decision. The 33 women that ended up getting sterilized had accidental pregnancies. One had lost her infant child, and one had said she would fear that she would have not felt completely feminine after the tubal ligation surgery. Therefore, she had her husband get a vasectomy. In another study conducted by PMC's 2017 article, they discuss how many women regretted their choice of getting a tubal ligation. A study of 837 women participated in a survey regarding their tubal ligation surgery. PMC stated that their findings revealed that 28% of U.S. women who had got tubal ligation regretted their choice. Not only is female sterilization more expensive than vasectomies, but also way safer than women's sterilization. In Mayo Clinic's 2021 article, they discussed the many risk factors that women's sterilization can cause. Now, tubal ligation has many dangers. It can damage the bladder, and it can also damage blood vessels. An ectopic pregnancy can form and is more likely to form, which I said before. It is when the egg gets stuck in the fallopian tubes and produces. Now, the healing process is very different compared to a vasectomy with a tubal ligation. A tubal ligation takes 4 weeks to heal, while a vasectomy is a 48-hour healing process. Here's another picture of the ectopic pregnancy. You can tell because the egg is in the fallopian tubes and it is actually bursted the fallopian tubes, which is very dangerous. In Planned Parenthood's 2021 article, they discussed the low risk factors of having a vasectomy done. A vasectomy procedure has very many low risk factors, unlike a tubal ligation procedure. A vasectomy includes bleeding, pain, and swelling. Now, the most common big risk factor is a hematoma, which is a bruise with blood filled, but this normally goes away by itself. Now, long-term pain is very uncommon. 2 to 6% of men do experience long-term pain, but it is very unlikely. However, some men do. Now, this is what a normal male reproductive system looks like, and this is what a vasectomy looks like. They do look very similar, but however, you can tell that the vas deferens are cut, causing the sperm not to be able to go down, while the vas deferens with the normal male reproductive system aren't cut. In Harvard's library, 2013, they discuss a study about a woman who have got cancer of a tubal ligation. Now, Harvard University conducted an experiment of roughly 14,000 women. They wanted to see if a tubal ligation had any long-term effects. They wanted to see if tubal ligation had caused cancer or tumors. They found that tubal ligation did not cause any tumors. However, it did cause endometrioid cancer. Now, if you and your partner ever decide not to have kids and the question comes up, who should get sterilized? It should be the male that gets a vasectomy, because vasectomies are reversible rather than tubal ligation. Female sterilization is way more expensive than vasectomies, and vasectomies are way safer than women's sterilization. So to avoid death, according to the health teacher in Mean Girls, don't have sex or you'll die. But if you want to get technical, there is a safer way to form sexual intercourse, and that is by a male getting a vasectomy and a woman not getting sterilized. Thank you.